What's up, guys? Today we are tackling the subject of pregnancy and carpal tunnel. Stay tuned.
How can I help you today?
Oh, the joys, the demise, the pain, the suffering, everything having to do with pregnancy. Now, guys, one of the things that we very commonly see, especially here in practice, is a person coming in saying, "Hey, Dr. Beau, I'm pregnant." It's usually during the late stages of pregnancy. And they come in and they say, "Beau, I have the worst carpal tunnel." Now, it can be in one side or it can be in both sides. And they're often wondering, is this something surgical I have to have done? What do I do about it? What can I do about it? Is it going to stay after pregnancy? So today, guys, I want to kind of just talk you through some of the protocols that I use here in my practice with my patients who are pregnant and experiencing carpal tunnel. Now, the first thing to note is this. Why? Why is it happening? Now, the number one reason that a pregnant patient is experiencing carpal tunnel is because of water retention. As the body is preparing for delivery, as you're growing a human being, you're retaining more nutrients and more fluids throughout all the tissues of your body. Now, it happens to show up, meaning compression of certain nerves, in areas where there is just not as much space, so to speak, and we're putting a lot of water in those areas. And that one of those areas is the wrists, the other ones are the ankles. But for the sake of this video, let's talk about that. So if a patient's coming in, or if you are pregnant and experiencing carpal tunnel, like I said, it can be in both sides or it can be just in one side. But typically, the woman will say, "Hey, Beau, I have a lot of pain, a lot of tenderness in the upper forearm region, and I'm getting numbness and tingling down into my hand." Now, traditional carpal tunnel syndrome affects a nerve called your median nerve. And your median nerve travels up through the elbow, goes through this carpal tunnel, so to speak, where all of these different bones sit on the top of it here. It travels underneath the median nerve and it goes to these three fingers. So it goes to your thumb, your pointer finger, and your middle finger, as well as the muscles here in the actual palm. So in traditional speaking, when a person has carpal tunnel, they'll come in and say, "Hey, Beau, I have a lot of tension that's happening here. I get some numbness and tingling here." They will typically not say it happens here. That's a different nerve that is affected there. But pregnancy, sometimes they'll say throughout, but the worst is right through there. So a couple of things that we do, the gold standard test is a test called Phelan's test. And simply what you do is put your hands at 90 degrees and you push them together and you hold here for a couple of minutes, actually. And we see if we can recreate any of that numbness and tingling. So a lot of times, though, the patient's coming in, they're saying, "Beau, I definitely have this. What can I do about it?" So a couple things. First off, we want to, number one, try to reduce the amount of water retention that's happening in that area. So we can do that through a couple of different ways. The first way is, obviously, as a chiropractor, I want to be able to check and adjust all of the bones of the wrist, of the hand, of the elbow. And the reason that being is because if those bones are pushed downwards, that's compressing and making that carpal tunnel even smaller. Now, obviously, the thing that people typically think about is carpal tunnel coming from like a desk job. So if the woman is still working, then we have to talk about making some ergonomic changes, maybe going to like some sort of dictation instead of doing a lot of typing. Or if they're they work in a supermarket and they're scanning groceries, or they're carrying a lot of trays if they're a server. So we always look at their ergonomic setup. Now, beyond that, a couple other things that we can do. I have a kind of a protocol here that I've kind of developed, and I thought I would just share it with you guys if that's okay. As far as nutrients, different things that you can kind of take and use yourself. So number one, we want to try to reduce all the inflammation that's happening in the body as well, because inflammation causes retention, it causes swelling. So we want to make sure that we consume foods that are very anti-inflammatory. So foods that are high in B6 help with nerve conduction. So bananas, avocados, potatoes, nuts, bluefin tuna, salmon, chicken, whole grains, sweet potatoes. We want to reduce and get rid of all salty foods. So foods that contain a lot of sodium. Sodium promotes water retention. It can actually aggravate the carpal tunnel syndrome. Now, beyond that, some different supplementation. Now, if you're pregnant, number one, you better be taking a pregnant multivitamin. If you're not, then we just want to start there, because there's so many things that are important as far as pregnancy and taking a multivitamin. So you're developing a fetus, a baby. We want to give them all of the correct nutrients. Now, in addition to that, you can look at taking things like coenzyme Q10, which helps to improve oxygenation of the tissue. Like I said, you want to make sure that your multivitamin has good B complex multivitamins. Vitamins are really essential for nerve health as well. Matter of fact, a lot of people, if they're having nerve issues, they will just give them a B multivitamin. And then lastly, zinc. Zinc helps to heal the surrounding tissue. So those are some basic nutrients, supplementation, things that you can take. Now, a couple other things that are just kind of helpful: grape seed extract, kelp, manganese. We talked about multivitamins, vitamin A, vitamin C, different types of foods that you can consume. Pineapple, because pineapple has something called bromelain in it, and that really helps to reduce a lot of inflammation. Anything, guys, that's going to help to reduce inflammation. So like your green leafy vegetables, your kales, your salads, those types of things. Those things actually reduce inflammation. And then lastly, believe it or not, we want to make sure that your hydration is on point as well, because when the body becomes dehydrated, it actually retains more water. So we want to make sure that we're increasing our water hydration. Now, as far as things that your partner can do, massage is incredible for it. Now, I'm not talking about massaging the back of your neck as much as you may want it, but actually massaging down here on the tissue. Now, what we don't want is where you're digging in over the tissue. We want, actually, they call it euphallage, is basically you're taking it from the distal portion and you're massaging it back towards the heart. That will actually help to reduce the amount of inflammation that's happening down here. You can try kinesio tape. Kinesio tape is this tape that you can lay over the different portions of the arm and a little bit in the wrist as well. That can actually aid in reducing water retention as well. And then lastly, guys, we talked about chiropractic works wonders for this. Now, last thing I'll say about this is that carpal tunnel syndrome with pregnancy, like 99% of the time, goes away within days, if not weeks at the most, that I've ever seen with any of my patients. And yes, guys, I know it sucks. Yes, I know it's painful. Yes, I know it's tight. Try all these things. Do all of these things. Someone will say, "Beau, is it okay if I wear a splint?" You can if you want. At this point, like whatever makes you most comfortable, we want to make sure that we try at least and to do. Now, with any of these vitamins, these supplements that I talked to you guys about and shared with you, make sure you consult with your OBGYN, your medical doctor, because we want to make sure that your plan is perfectly dialed in for you and your baby. Now, if you experienced carpal tunnel syndrome while you were pregnant, please let me know. Answer it down in the comments. As always, I jump back in there, guys. If you guys have looked at any of my YouTube videos, anything on Instagram, I'm always in there answering your guys' questions, and I know there's a lot of them, so I do my absolute best. All right, guys, if anything else, I'm always here. Have a good one. I'll talk to you on the next one.